Hi, my name is Ashley Castellanos, and today I'll be presenting on U.S. healthcare reform. First, we're going to look at the performance of the current U.S. healthcare delivery system. Then we'll discuss what universal healthcare looks like. Then we'll look at what universal healthcare coverage really takes to provide. We'll also discuss how universal healthcare coverage improves quality and population health status. Lastly, we'll discuss how universal healthcare coverage can decrease the inflation rate for healthcare spending. The current U.S. healthcare system is one of the most complex and expensive systems in the world. It is by far one of the most expensive, and unfortunately, those expenses do not mean better quality of care. Let's take a look at the cost. The United States spends $3.3 trillion, or $10,328 per person, on healthcare expenditures. This totals to about 17.9% of its gross domestic product. The per capita personal healthcare expenditures for the total U.S. population was $8,788 in 2016. Personal healthcare expenditures were 11.6% for prescription drugs alone, 38.2% for hospital care, and 23.5% for clinical and physician services. Now, the quality. Quality of care scores are lower for the U.S. compared to other industrialized countries in terms of safety and coordinated care. Infant mortality rates rank higher than those of many other countries. There are also racial disparities in disease and death rates. Quality of care also differs based on insurance coverage and even the hospital in which you're treated. The Organization for Economic Cooperation and Development's average is 3.2 practicing physicians per 1,000 people, but the U.S. has 2.5 per 1,000 and a lower number of hospital beds on top of it. The accessibility. The U.S. does not provide any type of universal coverage. Citizens who are not eligible for government programs are presumed to pay for health insurance on their own or the actual health services themselves. The majority of individuals have private insurance, accounting for 67.2%, while 32.7% had government coverage. Unfortunately, 8.8% of the population is uninsured. Only basic ambulatory services are provided by the government alongside Medicaid and Medicare for those who qualify for those programs. Let's take a look at universal health coverage. In the adoption of universal health coverage, everyone participates under a single payer plan. This plan is administered and financed by the government. Under a monopsonistic healthcare plan, the government is the only purchaser of healthcare. The government creates a ceiling on overall healthcare spending by setting budgets for hospitals and nursing homes. A separate budget is also set at times in order to control investments in medical technology. Universal healthcare provides a basic benefits package that would cover all medical services to the entire public, regardless of financial or employment status. Everyone has a primary care physician and receives age-appropriate care. It eliminates financial barriers and allows for the highest standard of care for the entire public. Deductibles and co-payments are also eliminated. Provide universal health coverage. To improve access to care, a single-payer system would be the most successful and efficient. It could model the single-payer system in Canada, which provides a universal benefits package for all of its citizens. The U.S. would also implement restrictions on private insurances in order to ensure the same quality of care for all. Individuals would be free from any financial burden due to elimination of co-pays and deductibles. In order to maintain a high standard of care, hospitals would receive a budget for all expenses from the government itself, which is a single purchaser of healthcare. This would be done from a federal and state government level. Hospitals, of course, would be required to treat all patients, along with providing a primary care physician for everyone. The US healthcare system would have to refocus on preventative measures instead of sick care and eliminate problems with the uninsured. By allowing the government to choose and support the healthcare system, it would promote efficiency and equity in areas such as a person's historical background and culture. This would be a result of the public having access to primary care physician and preventative care. Having this access to a primary care physician means more routine visits, and this allows for a physician to assess a person's needs on an individual basis. Government intervention is justified by the increased equity and efficiency that would be achieved under universal health care. Equity is the most important factor, and the existence of market failure show the system is flawed and government intervention is necessary. Universal healthcare coverage can also improve the quality of care and the population health status. Everyone will have healthcare coverage, which will provide equal access to age-appropriate and evidence-based healthcare services. Patients would not be discriminated against based on age, gender, race, socioeconomic factors, or health status, including any pre-existing conditions. Budgets for hospitals will control spending and provide the same quality of care for all. It will also reinvigorate the primary care infrastructure by guaranteeing that everyone has access to a primary care physician. Increased care has the potential to increase health status and increase patient monitoring. Routine care, along with continued medical record keeping, can improve the quality of care and cater to more individualized needs. Preventative care services would also be available to all, such as vaccines and screening programs. A focus on reducing preventable diseases would also improve the overall population health status. Universal health care coverage would also decrease the inflation rate for healthcare spending. One method to decrease inflation with a single payer system is to implement the consistent use of outpatient clinics. This system can reduce the average stay in hospitals, which leads to a better allocation of resources and decreased costs. Going to outpatient clinics for services such as vaccines or preventative screenings, along with surgeries, would allow spending in hospitals to be focused elsewhere. The reduction in indirect social costs by the uninsured would also be subtracted from the increase in healthcare costs. When a person goes into the emergency room and they are uninsured, the government has to pay large sums of money in order to treat this person. But under a universal healthcare program, the large sums of money would not be necessary as everyone would have insurance. Even though a single payer system results in higher taxes, individuals lose the responsibility of paying for premiums and for insurances. They get to save that money. The federal government would also have stronger leverage to negotiate lower rates for medical services, drugs, medical devices, and provider payments. This is especially necessary for helping curb the cost of prescription drugs, which are so ridiculously expensive. An increase in the quality of care and controlled spending would also decrease the inflation rate for healthcare spending. Universal healthcare coverage would better coordinate primary and preventative care, which would reduce the high costs of tertiary prevention. Due to the less complex nature of a universal healthcare plan, money would be saved in administrative costs. The high costs currently come from complexities in billing caused by a multiple payer system. Of all hospital spending, 25% goes towards administrative costs. And this is a huge difference compared to countries like Canada that only dedicate 12% of hospital spending to administrative costs. We would be able to save money in areas like that as well. Overall, universal healthcare coverage has great potential, and it has the ability to improve the quality of care and to improve the population health status. It means that everyone would have the opportunity to receive this quality care, and it would also be able to decrease the inflation rate for healthcare spending, an issue which is currently plaguing the US. Thank you.